After completion of the genus Trypanosoma, now it's time to discuss about the genus Leishmania. The members of the genus Leishmania are obligate intracellular parasites of macrophage in the vertebrate host, and the Leishmania species are transmitted by a vector called sandfly or phlebotomous species, and these are also hemoflagellates. And the developmental cycle include the two forms. Those are a mastigote form which occur in the macrophage of the vertebrate host, and a promastigote form which occur in the intestine of the sandfly or vector. Now let us come to the morphology of the amastigote form. In the amastigote form, it divide of the flagella, therefore they are non-motile and ovoid structure. Ordinarily they are seen within the macrophage. And the promastigote form are motile, spindle shaped with no undulating membrane. The life cycle include in vertebrate host and in vector. In vertebrate host, a mastigote form of Leishmania occur in the macrophage, endothelial, reticuloendothelial cells, spleen, liver, bone marrow, lymph node, mucosa, and skin. Mastigote forms are known as Leishman-Donovan bodies in the bloodstream. They multiply by binary fission in a mastigote. Now let us come to the life cycle in the vectors, that is in phlebotomous fly. Whenever the sandfly suck the blood, the amastigote enter into the midgut of the intestine, where they become promastigote. They multiply by binary fission. They puncture the skin of the animal, thus discharging the promastigote form into the host. Then these enter the body, invade the cell of the macrophage system, and become a mastigote, and multiply in the cell and ultimately destroy the cell. Then the liberated mastigote forms are engulfed by new macrophages. These are also engulfed by neutrophils and eosinophils and destroy them. Now let us come to the species of the genus Leishmania, which include Leishmania donovani and Leishmania tropica. Leishmania donovani is responsible to the visceral leishmaniasis, and Leishmania tropica, which is responsible to the cutaneous form of leishmaniasis. Now let us come to the first species, that is Leishmania donovani. This is named after the Sir William Leishman, who discovered Leishmania donovani in a spleen at Dum Dum, is the city in Calcutta, India, and he published in 1903. Simultaneously, Charles Donovan in 1903 also reported the parasite in Chennai, so the species is named after these two scientists as Leishmania donovani. Now let us come to the disease caused by this Leishmania donovani, which is called by several names as visceral leishmaniasis, Kala Azar, black or deadly sickness, black fever, dum-dum fever, tropical splenomegaly, reticuloendotheliosis. In India, Kala Azar is not a genetic disease. It is only an anthropognosis, which means man-to-man transmission is there, but in Mediterranean and China, it is transmitted from animals to human beings, where it is a genetic disease, and dog act as a reservoir host. Man and dog act as the principal host for the Leishmania donovani, and sandfly or phlebotomous fly is act as a vector for the transmission of Leishmania donovani. And life cycle include life cycle in vertebrate host and in intermediate, that is in vector. And the mastigote form of the Leishmania donovani is occur in the vertebrate host, while in the promastigote form is occur in the vector. Whenever the phlebotomous fly will bite the host, thereby it will introducing the promastigote form of the Leishmania donovani into the host. Thereby this will enter the macrophages of the host, thereby where it will brush the macrophage and leads the formation of a mastigote form, and those mastigote forms are again taken up by the nearby macrophages, neutrophils, and leading to the destruction of those body cells. When it comes to the distribution, this disease is distributed in India, Sudan, China, Mexico, South America, and African countries. Mostly in India, it is most prevalent in Assam, Bihar, Bengal, China, and Uttar Pradesh. Now let us come to the disease Kala Azar. Kala Azar is an fatal disease in India. Kala Azar is essentially reticuloendotheliosis disease, in which promastigote stage are inoculated into the skin by sandfly bite. It reach nearby macrophages they are engulfed by them by phagocytosis. Then they proliferate and metamorphose to a mastocyte within the host cell of the host cells. A mastocyte multiplies slowly for about week or month. Then some macrophages get enter into the bloodstream and are carried from skin to visceral organs, lodge into the reticuloendothelial cells, spleen, liver. Kupffer cells are the macrophages of the liver, bone marrow, and they destroy the macrophage. Hypertrophy of the organs noticed leads to the suppression of blood cellular elements, which include RBC, leukocytes, except monocytes. Due to destruction of macrophages, there will be the compensatory production of macrophages and phagocytes. And in advanced cases, digestive tract involvement results in diarrhea, emaciation, and abdomen distension. And there is infiltration of parasitized macrophages into all organs, including skin, where they cause hair loss and hairless ulcers, especially in dogs, that is the cutaneous form of the Kala-Azar. When it comes to the clinical signs, which include irregular fever and hypertrophy of the spleen and liver, which that is nothing but the hepatomegaly and splenomegaly, and anemia, symptoms like headache, occasional abdominal pain, dysentery, diarrhea are common. Hemorrhage in the mucous membrane of the mouth and nostrils, skin darkens, and the characteristic feature of the disease essentially is the reticuloendotheliosis, where macrophages, myelocytes, and polymorphonuclear cells of the bone marrow are filled with the parasites. The lymph nodes are usually enlarged. Now, let us come to the diagnosis of the Leishmania Donovani. It can be diagnosed by preparing the peripheral blood smear or a thick blood smear and a culture of the blood in a tryptophan medium, and can also be used the chick embryo yolk, a biopsy from the sternal or iliac lymph node, spleen, liver, and bone marrow. Animal inoculation method can also be carried out. The animal used is the golden hamster, and indirect methods include the blood picture, that is in acute mild leukopenia, slight anemia, and in chronic phase there is progressive hyperchromic anemia will be there. And serological tests include indirect hemagglutination test, indirect fluorescent antibody, and a component fixation test, and also ELISA can be carried out. When it comes to the treatment, sodium stibogluconate is the drug of choice for the treating Kala-Azar, and amphotericin B can be used. When it comes to the control, sandfly control with chlorinated hydrocarbons and organophosphorus chloride spray at breeding places, insect repellents, and removal of decaying vegetation, mosquito nets, and destruction of stray dogs to remove reservoir hosts. Now, let us come to the post-Kala-Azar dermal leishmaniasis. This condition is noticed in the patient, those who get cured from the Kala-Azar, and in which Leishmania donovani parasite resides in the skin and develops there and manifests as the dermal lesions. The dermal lesions include hypopigmented macules, which are similar to the macular lesions of lepromatous leprosy, and erythematous butterfly rash, which may be aggravated by exposure to the sunlight, erythematous papules and nodules, which are usually occur on face, especially the chin. Sodium stibogluconate can be used to treat the post-Kala-Azar leishmania dermal leishmaniasis. Now let us come to the Leishmania donovani in dogs. The Leishmania donovani is responsible to cause visceral and or cutaneous form of the leishmaniasis, and which is usually low mortality. And the cutaneous form which is more common, it include emaciation, keratitis, scaling up lesion, seborrhea, and ulceration and alopecia. Anemia, clinical signs such as anemia, emaciation, abundant discoloration of skin, and cutaneous ulcers are also noticed, and hair loss patches, especially on face and eyelids, are more pronounced, and generalized eczema can also be seen. And with the visceral form, the disease can be severe, causing clinical signs in many organs. There are extreme weakness, wasting, diarrhea, epistaxis, lameness, anemia, renal fever, edema of the feet, dermal ulceration, eye inflammation leading to blindness, Lymphadenopathy, hepatosplenomegaly is also be noticed in the visceral form of the Leishmania Donovani in dogs. Vaccine is available in Brazil against the Leishmania Donovani for the dog. It is known as against the dog is known as Leishmania. This is about Leishmania Donovani in dog and in man. In next video, we will discuss Leishmania tropica, which causes the cutaneous form of the leishmaniasis, which is also called as oriental sore. Thank you.